What is type 2 diabetes? Is a chronic diseases. Type 2 diabetes is a condition that happens because of a problem in the way the body regulates and uses sugar as a fuel. That sugar also is called glucose. This long-term condition results in too much sugar circulating in the blood. Eventually, high blood sugar levels can lead to disorders of the circulatory, nervous, and immune systems. In type 2 diabetes, there are primarily two problems. The pancreas does not produce enough insulin, a hormone that regulates the movement of sugar into the cells. And cells respond poorly to insulin and take in less sugar. Type 2 diabetes used to be known as adult-onset diabetes, but both type 1 and type 2 diabetes can begin during childhood and adulthood. Type 2 is more common in older adults, but the increase in the number of children with obesity has led to more cases of type 2 diabetes in younger people. There's no cure for type 2 diabetes. Losing weight, eating well, and exercising can help manage the disease. If diet and exercise aren't enough to control blood sugar, diabetes medications or insulin therapy may be recommended. Symptoms. Symptoms of type 2 diabetes often develop slowly. In fact, you can be living with type 2 diabetes for years and not know it. When symptoms are present, they may include increased thirst, frequent urination, increased hunger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infections, numbness or tingling in the hands or feet, areas of darkened skin, usually in the armpits and neck. Diagnosis. Type 2 diabetes is usually diagnosed using the glycated hemoglobin A1C test. This blood test indicates your average blood sugar level for the past 2 to 3 months. Results are interpreted as follows. Below 5.7% is normal. 5.7% to 6.4% is diagnosed as prediabetes. 6.5% or higher on 2 separate tests indicates diabetes. If the A1C test isn't available, or if you have certain conditions that interfere with an A1C test, your healthcare provider may use the following tests to diagnose diabetes. Random blood sugar test. Blood sugar values are expressed in milligrams of sugar per deciliter, mg/dl, or millimoles of sugar per liter, mol/L, of blood. Regardless of when you last ate, a level of 200 milligrams per deciliter, 11.1 millimoles per liter, or higher suggests diabetes, especially if you also have symptoms of diabetes, such as frequent urination and extreme thirst. Fasting blood sugar test. A blood sample is taken after you haven't eaten overnight. Results are interpreted as follows. Less than 100 milligrams per deciliter, 5.6 millimoles per liter, is considered healthy. 100 to 125 milligrams per deciliter, 5.6 to 6.9 millimoles per liter, is diagnosed as prediabetes. 126 milligrams per deciliter, 7 millimoles per liter, or higher on 2 separate tests is diagnosed as diabetes. Oral glucose tolerance test. This test is less commonly used than the others, except during pregnancy. You'll need to not eat for a certain amount of time and then drink a sugary liquid at your healthcare provider's office. Blood sugar levels then are tested periodically for 2 hours. Results are interpreted as follows. Less than 140 milligrams per deciliter, 7.8 millimoles per liter, after 2 hours is considered healthy. 140 to 199 milligrams per deciliter, 7.8 millimoles per liter, and 11.0 millimoles per liter, is diagnosed as prediabetes. 200 milligrams per deciliter, 11.1 millimoles per liter, or higher after 2 hours suggests diabetes. Screening. The American Diabetes Association recommends routine screening with diagnostic tests for type 2 diabetes in all adults age 35 or older, and in the following groups. People younger than 35 who are overweight or obese and have one or more risk factors associated with diabetes. Women who have had gestational diabetes. People who have been diagnosed with prediabetes. children who are overweight or obese, and who have a family history of type 2 diabetes or other risk factors. After a diagnosis, if you're diagnosed with diabetes, your healthcare provider may do other tests to distinguish between type 1 and type 2 diabetes, because the two conditions often require different treatments. Your healthcare provider will test A1C levels at least 2 times a year, and when there are any changes in treatment. Target A1C goals vary depending on age and other factors. For most people, the American Diabetes Association recommends an A1C level below 7%. You also receive tests to screen for complications of diabetes and other medical conditions. Treatment. Management of type 2 diabetes includes healthy eating, regular exercise, weight loss, possibly diabetes medication or insulin therapy, blood sugar monitoring. These steps make it more likely that blood sugar will stay in a healthy range, and they may help to delay or prevent complications. Healthy eating. There's no specific diabetes diet. However, it's important to center your diet around a regular schedule for meals and healthy snacks, smaller portion sizes, more high-fiber foods such as fruits, non-starchy vegetables, and whole grains, fewer refined grains, starchy vegetables, and sweets, modest servings of low-fat dairy, low-fat meats, and fish, healthy cooking oils such as olive oil or canola oil, fewer calories. Your healthcare provider may recommend seeing a registered dietitian who can help you identify healthy food choices, plan well-balanced nutritional meals, develop new habits, and address barriers to changing habits. Monitor carbohydrate intake to keep your blood sugar levels more stable. Physical activity. Exercise is important for losing weight or maintaining a healthy weight. It also helps with managing blood sugar. Talk to your healthcare provider before starting or changing your exercise program to ensure that activities are safe for you. Aerobic exercise. Choose an aerobic exercise that you enjoy, such as walking, swimming, biking, or running. Adults should aim for 30 minutes or more of moderate aerobic exercise on most days of the week, or at least 150 minutes a week. Resistance exercise. Resistance exercise increases your strength, balance, and ability to perform activities of daily living more easily. Resistance training includes weightlifting, yoga, and calisthenics. Adults living with type 2 diabetes should aim for 2 to 3 sessions of resistance exercise each week. Limit inactivity. Breaking up long periods of inactivity, such as sitting at the computer, can help control blood sugar levels. Take a few minutes to stand, walk around, or do some light activity every 30 minutes. Weight loss. Weight loss results in better control of blood sugar levels, cholesterol, triglycerides, and blood pressure. If you're overweight, you may begin to see improvements in these factors after losing as little as 5% of your body weight. However, the more weight you lose, the greater the benefit to your health. In some cases, losing up to 15% of body weight may be recommended. Your healthcare provider or dietitian can help you set appropriate weight loss goals and encourage lifestyle changes to help you achieve them. Monitoring your blood sugar. Your healthcare provider will advise you on how often to check your blood sugar level to make sure you remain within your target range. You may, for example, need to check it once a day and before or after exercise. If you take insulin, you may need to check your blood sugar multiple times a day. Monitoring is usually done with a small, at-home device called a blood glucose meter, which measures the amount of sugar in a drop of blood. Keep a record of your measurements to share with your healthcare team. Continuous glucose monitoring is an electronic system that records glucose levels every few minutes from a sensor placed under the skin. Information can be transmitted to a mobile device such as a phone, and the system can send alerts when levels are too high or too low. Diabetes medications. If you can't maintain your target blood sugar level with diet and exercise, your healthcare provider may prescribe diabetes medications that help lower glucose levels, or your provider may suggest insulin therapy. Medicines for type 2 diabetes include the following. Metformin, Fortamit, Glumetza, others, is generally the first medicine prescribed for type 2 diabetes. It works mainly by lowering glucose production in the liver and improving the body's sensitivity to insulin, so it uses insulin more effectively. Some people experience B12 deficiency and may need to take supplements. Other possible side effects, which may improve over time, include nausea, abdominal pain, bloating, diarrhea. Sulfonylureas help the body secrete more insulin. Examples include glyburide, diabeta, glinase, glipizide, glucotrol XL, and glympyride amyral. Possible side effects include low blood sugar, weight gain. Glinides stimulate the pancreas to secrete more insulin. They're faster acting than sulfonylureas, but their effect in the body is shorter. Examples include repaglinide and nataglinide. Possible side effects include low blood sugar, weight gain. Thiazolidinediones make the body's tissues more sensitive to insulin. An example of this medicine is pioglitazone actose. Possible side effects include risk of congestive heart failure, risk of bladder cancer, pioglitazone, risk of bone fractures, weight gain. DPP-4 inhibitors help reduce blood sugar levels, but tend to have a very modest effect. Examples include sitagliptin Januvia, saxagliptin Onglyza, and linagliptin Tradjenta. Possible side effects include risk of pancreatitis, joint pain. GLP-1 receptor agonists are injectable medications that slow digestion and help lower blood sugar levels. Their use is often associated with weight loss, and some may reduce the risk of heart attack and stroke. Examples include exenatide, Byetta, Bydureon Pseudoephedrine, liraglutide, Saxenda, Victoza, and semaglutide, Rybelsus, Ozempic, Wegovy. Possible side effects include risk of pancreatitis, nausea, vomiting, diarrhea. SGLT2 inhibitors affect the blood filtering functions in the kidneys by blocking the return of glucose to the bloodstream. As a result, glucose is removed in the urine. These medicines may reduce the risk of heart attack and stroke in people with a high risk of those conditions. Examples include canagliflozin Invokana, dapagliflozin Farxiga, and empagliflozin Jardiance. Possible side effects include vaginal yeast infections, urinary tract infections, low blood pressure, high cholesterol, risk of gangrene, risk of bone fractures, canagliflozin, risk of amputation, canagliflozin. Other medicines your healthcare provider might prescribe in addition to diabetes medications include blood pressure and cholesterol-lowering medicines, as well as low-dose aspirin, to help prevent heart and blood vessel disease. Insulin therapy. Some people who have type 2 diabetes need insulin therapy. In the past, insulin therapy was used as a last resort, but today it may be prescribed sooner if blood sugar targets aren't met with lifestyle changes and other medicines. Different types of insulin vary on how quickly they begin to work and how long they have an effect. Long-acting insulin, for example, is designed to work overnight or throughout the day to keep blood sugar levels stable. Short-acting insulin generally is used at mealtime. Your healthcare provider will determine what type of insulin is right for you and when you should take it. Your insulin type, dosage, and schedule may change, depending on how stable your blood sugar levels are. Most types of insulin are taken by injection. Side effects of insulin include the risk of low blood sugar, a condition called hypoglycemia, diabetic ketoacidosis, and high triglycerides. Weight loss surgery. Weight loss surgery changes the shape and function of the digestive system. This surgery may help you lose weight and manage type 2 diabetes and other conditions related to obesity. There are several surgical procedures. All of them help people lose weight by limiting how much food they can eat. Some procedures also limit the amount of nutrients the body can absorb. Weight loss surgery is only one part of an overall treatment plan. Treatment also includes diet and nutritional supplement guidelines, exercise, and mental health care. Generally, weight loss surgery may be an option for adults living with type 2 diabetes who have a body mass index, BMI, of 35 or higher. BMI is a formula that uses weight and height to estimate body fat. Depending on the severity of diabetes or the presence of other medical conditions, surgery may be an option for someone with a BMI lower than 35. Weight loss surgery requires a lifelong commitment to lifestyle changes. Long-term side effects may include nutritional deficiencies and osteoporosis. Pregnancy. People living with type 2 diabetes often need to change their treatment plan during pregnancy and follow a diet that controls carbohydrates. Many people need insulin therapy during pregnancy. They also may need to stop other treatments, such as blood pressure medicines. There is an increased risk during pregnancy of developing a condition that affects the eyes called diabetic retinopathy. In some cases, this condition may get worse during pregnancy. If you are pregnant, visit an ophthalmologist during each trimester of your pregnancy and 1 year after you give birth, or as often as your healthcare provider suggests. Signs of trouble. Regularly monitoring your blood sugar levels is important to avoid severe complications. Also, be aware of symptoms that may suggest irregular blood sugar levels and the need for immediate care. High blood sugar. This condition also is called hyperglycemia. Eating certain foods or too much food, being sick, or not taking medications at the right time can cause high blood sugar. Symptoms include frequent urination, increased thirst, dry mouth, blurred vision, fatigue, headache, hyperglycemic hyperosmolar non-ketotic syndrome (HHNS). This life-threatening condition includes a blood sugar reading higher than 600 milligrams per deciliter, 33.3 millimoles per liter. HHNS may be more likely if you have an infection, are not taking medicines as prescribed, or take certain steroids or drugs that cause frequent urination. Symptoms include dry mouth, extreme thirst, drowsiness, confusion, dark urine, seizures. Diabetic ketoacidosis. Diabetic ketoacidosis occurs when a lack of insulin results in the body breaking down fat for fuel rather than sugar. This results in a buildup of acids called ketones in the bloodstream. Triggers of diabetic ketoacidosis include certain illnesses, pregnancy, trauma, and medicines, including the diabetes medicines called SGLT2 inhibitors. The toxicity of the acids made by diabetic ketoacidosis can be life-threatening. In addition to the symptoms of hyperglycemia, such as frequent urination and increased thirst, ketoacidosis may cause nausea, vomiting, abdominal pain, shortness of breath, fruity-smelling breath, low blood sugar. If your blood sugar level drops below your target range, it's known as low blood sugar. This condition also is called hypoglycemia. Your blood sugar level can drop for many reasons, including skipping a meal, unintentionally taking more medication than usual, or being more physically active than usual. Symptoms include sweating, shakiness, weakness, hunger, irritability, dizziness, headache, blurred vision, heart palpitations, slurred speech, drowsiness, confusion. If you have symptoms of low blood sugar, drink or eat something that will quickly raise your blood sugar level. Examples include fruit juice, glucose tablets, hard candy, or another source of sugar. Retest your blood in 15 minutes. If levels are not at your target, eat or drink another source of sugar. Eat a meal after your blood sugar level returns to normal. If you lose consciousness, you need to be given an emergency injection of glucagon, a hormone that stimulates the release of sugar into the blood.